professionally produced video, so bear with me. I'll probably delete this and put the better version on later. It's Saturday morning, 8:33 Eastern time. I'm a mile and a half into a morning walk. And last night at dinner, the disturbing news came out that Medicare has changed the way that it's done business in the past. And they've announced the numbers for 2022 for the Part B premium, which has gone up 14.8% in 1 year, which has never happened before, and directly counters the recommendation of the Medicare Trustees Report. Medicare Trustees Report includes the cabinet secretaries from different things like Department of Labor, Treasury, and so on. Sorry about the unstable focus here. So anyway, the shocking part is that the Part B premium that everyone has to pay is going up to $170.10 from $148.50. That means nearly $260 a year extra is going to be paid by seniors at a time when, actually if I turn this way, start heading back, the sun's in the right location. At a time when inflation is at a 31-year historic high, things are costing more. And who does that impact more? It impacts the people who can't work overtime to make up the difference. It impacts people who are, there are the geese out for their morning flight. Love this neighborhood. Sorry, I'm just sharing real life with you. So again, the big news that, and there's a reason behind it that I think is more insidious than the actual numbers. So when Medicare decided to not listen to the trustees and they went full tilt on passing on these extra costs, they're not extra from today. That's the problem. That's the problem that I have with it. When you take a senior and you're saying, look, in 2022, starting in January, we're going to start taking $260 a year more out of your Social Security check to pay for something that we think is going to happen. And that's what they've said. The drug that I covered some 6 months ago, it's the new drug for Alzheimer's, which just barely won FDA approval. Matter of fact, someone resigned from the FDA because they didn't think that this should have been approved at all, this drug. It's just not studied enough. But it's a Part B administered drug, which means Part B administered drugs are paid for by Medicare, Part B. They don't go into the drug plans of Part D drug plans. Sorry, I'm a little winded, slowing down at the 2-mile mark to talk and walk. So Medicare anticipates that the impact of this drug, which is not even being given out yet, is going to cost Medicare billions of dollars in the future. For the first time ever, the folks at CMS, the current administration, has thought, well, let's get in front of this and let's pass these costs that aren't cost yet, these anticipated costs, let's pass those on to seniors now. And the deductible for Medicare going up as well from $203 to $233 is also a departure from what the trustees had recommended based on the numbers, the current numbers, the real numbers. So the trustees had said it might go to $215, $217 is what they put in the report. Instead of going to $217 for the Part B deductible next year, they're going to $233. You might say, some people might say, this is not a big deal. Seniors have the extra money and they can pay an extra $260 a year for their same Medicare that they have now. Now, bear in mind, I want to show you something. I'm going to flip this screen here. There we go. Nice little ladies out joining me for a walk this morning. The deer in our neighborhood are very docile and come up to folks to let them feed them. They're wondering what I'm doing. So, inflation is running rampant. That's not even disputable now. No one's even claiming that it's not. And who does it impact more than anyone else? Those people on a fixed income who can't make it up elsewhere. So not only are they dealing with record inflation, food prices above all, They're now having to deal with an increase in Social Security withdrawal for their Medicare. Just insane. And again, it's not because of current numbers. It's because of what they anticipate being the cost of this new Part B drug. Those of you on Medicare Advantage who might think, well, this isn't going to impact me. Hello, lovely ladies. It is. Why is that? Because on Medicare Advantage, you still have to pay for your Part B participation in Medicare. It's ironic that Part A you've earned your whole life, Part B is subsidized, but you still have to pay it. And on Medicare Advantage, you can't just go into the doctor's office and say, here's my red, white, and blue card, Medicare is going to pay for that drug. As a matter of fact, I would challenge you and encourage you, if you're on Medicare Advantage or considering it this year, look under the small print on your summary of benefits and see what it says about Part B drugs. And that's where the Alzheimer's drug is going to fit, if it's approved at all, because managed care gets to choose what they approve or not approve. So on Part B drugs, which is outpatient chemotherapy drugs, immunosuppressants for things like transplants, when it's administered in the doctor's office, and it would have been paid under original Medicare under Part B, with Medicare Advantage, they will typically, with every plan I've ever seen, pass that cost directly on to you. You have to pay the 20% of that cost, as if you were on nothing but original Medicare with no supplement whatsoever. So look at that, because most agents won't tell you. Look under your summary of benefits on your Medicare Advantage plan and see how Part B drugs are handled. I think you might be quite surprised. Most people are. So that being the case, Medicare's shocking announcement that they're changing the Part B monthly premium starting in January of 2022 from $148.50 to $170.10 is unprecedented. It's never gone up 14.8% in 1 year. And the only problem that I have with it, and I posted on Facebook last night at dinner that this had just come out. First of all, whenever a presidential administration of any party wants to release bad news, something that they don't want to get a lot of fanfare or be picked up in the mainstream media, they will do it on a Friday night. So that was my first indication that something was going to be wrong. They did not want this out there to be covered, but it is going to be covered. And pretty bad deal. And again, it's not because of current cost. It's because of what they think is going to happen with Medicare. Everybody knows that the trust fund... Hello, little puppy. What a cute dog. Hello. Good morning. What a cutie. Everyone knows that the trust fund is, without an adjustment, slated to be cutting back on benefits significantly by law by 2025 at the latest right now. That's not what this is about. This is not addressing that whatsoever, or the shortfall in the trust fund. This is in anticipation of something that's supposed to happen in the future just because of this one drug. And so you're going to make more than 54 million Americans pay to subsidize a drug that barely squeaked through FDA approval, does not yet have a track record, and it's not even out there being administered yet. It's just absolutely crazy. In prior years, past administrations, not going to mention any parties, doesn't matter, but they've opted to deviate from the Medicare Trust Fund Advisory Panel to go the other way. We have very small incremental increases in the Part B deductible that seniors have to pay every year. Those on Plan F, Medicare Supplement, don't think that this is an advantage to you, because what happens to that, that's a bad word to use in this context, because what happens on Plan F, if you have it, the supplement pays the deductible for you, but the companies don't do that out of the kindness of their heart. They will immediately, at their next rate increase, cite this very thing, the increase in the deductible, as justification to the insurance commissioners to raise your rate accordingly. So not only do you have a typical all-you-can-eat buffet experience of Plan F, which generally causes the rate increase to be more than other plans that don't have the first dollar coverage, but now you have the increase that's going to come naturally as a part of this increase in the deductible. So if you're joining late, the Medicare deductible for 2022 was announced late under the cover of darkness on a Friday night to go from $203 to $233 before anything's paid. This affects everyone on original Medicare with no supplement. Also affects people on Plan G and Plan N. It will affect you when you go to the doctor for the first time in January when that deductible resets. Now, the good news is if you are on a Medicare supplement Plan G or Plan N, this will have no impact on your premium. The increase in Social Security, 5.9%. And so they say the government giveth and the government taketh away. And I think even if that was completely true, if the Social Security increase were to totally offset the increase in the Part B premium paid every month, which is now $170.10, and that's if you did not earn more than $91,000 individually for next year. That's the IRMAA rate. So if you were a high income earner, or you took a distribution, or you cashed in your 401k and it shows up on your taxes, or you sold your house, ranch, farm, condo, and it showed up as a gain on your taxes 2 years ago, then that puts you into IRMAA, the income-related Medicare adjustment amount, which will make you pay more than the already high $170.10 monthly for Part B of next year, 2022. So, like I was saying, even if the two offset each other, the 5.9% increase in your Social Security, unique to everyone, of course, and now the increase in the cost for Medicare Part B going up to $170.10, and the increase in the deductible going to $233 for 2022, even if they were completely even, now you've just subjected the fixed income crowd, for the vast majority, to the horrible rates of inflation that are happening now, which will directly impact them when it comes to food cost. Maybe you don't drive, maybe you take public transportation, maybe you ride with Uber somewhere. It's going to hit everybody on the food side. So I was just hoping that this administration would say, with all that seniors have gone through, with having the bullseye on them from the coronavirus impacting them more than any other demographic, with the food inflation, with the cost of everything going up, I would hope that they would use their discretion to look at the trustees' report with Medicare, which recommended $217 for the deductible, and say, you know what, let's just pull back like they did in 2021. It was passed that in 2021, there would be no increase in Part B or the deductible. That was great. What's the difference? If you can spend $1.9 trillion on improving runways on airports, or laying fiber optic line for kids to have the ability to stay home instead of going to school, why can't you then offset the increase to seniors one more stinking time? That's all I'm asking, because it is discretionary and it's not related to anything that are current costs. They're anticipating the cost of this new Alzheimer's drug is going to send Medicare through the roof in the future, so they want you, the senior, to pay for that now. So people ask me, as a matter of fact, I posted on Facebook last night at dinner, and someone, one of our clients, in fact, posted a comment and said, Chris, you need to keep your opinion out of it, because I said this is horrible. You need to keep your opinion out of it and just tell the truth. Well, I think that if you don't have an agent that cares about you or gives a rip about what's going on and tries to find ways to save you money and trying to find ways of you not getting screwed over by the government, you might need to find another agent who's just simply an order taker, because that ain't me. Every day we look for things in our office that can save seniors money or advocate for them with the national organization we're part of, called the National Association of Health Underwriters, which goes to Washington every year to meet with our congressional and Senate representatives to try to get something done on the side of seniors. And if you don't have an agent that's plugged in, or that's trying to do everything that they can on your behalf, or that doesn't even care and just simply reports what the numbers are, maybe you should go find someone else. And
total distance 2 miles.
Yeah.
Total time 44 minutes and 14
Oh,
seconds.
don't listen to my split time.
Split pace 25 minutes 9 seconds per mile.
It was a slow morning, but I'm walking and holding a 5-pound camera and chasing deer. You're like, gotta give me a break. But anyway, I wish you Godspeed. I'll put out a normal, appropriate, decent video at some point in the future, but I promised that I would put this out as soon as it came out. And just in case you missed the news, you know, Friday night, for one last time, the numbers from Medicare were slipped out on a Friday night, and they're changing the Part B premium that all seniors have to pay, regardless of if you're on original Medicare, Medicare with a supplement, or Medicare Advantage plan. Everybody's going to be impacted by this. The standard $148.50 per month out of your Social Security, now going up to $170.10. And I personally think that's a bad deal. The other side of it is the deductible for Part B, that's the outpatient parts, that will impact people on original Medicare, Plan G, Plan N, that deductible that starts again in January. Every January, without fail, we get hundreds of calls from people who say, my supplement isn't paying anything. Why do I have insurance? That's just because the deductible reset with Medicare. That's a part of Medicare. And that is going to reset. But this time, thanks to current things going on, it's going to be $233 that you have to pay first. The good thing is that $233, that deductible, is after Medicare has readjusted the bill. You know, typically a doctor will bill, you know, $400 for a visit. Medicare will laugh at that and say, no, the Medicare approved amount is maybe $150. So after Medicare adjusts the bill, then you will have to pay the first $233 of the year before your supplement, if it's Plan G or Plan N, will then kick in and protect you from an unlimited amount of losses that you could have if you had just original Medicare. Because with original Medicare, you're responsible for 20% of all Part B costs above and beyond that deductible with no out-of-pocket limit. With a Medicare supplement, you don't worry about that. Also, going in the hospital is going to be more of a cost if you don't have a supplement. I forgot that number right off, but I think it's going to $1,500 or $1,700 up from the $1,400 that it's at now. I'll put out the numbers. If you want to keep up with the updates for everything changing with Medicare for 2022, and then every subsequent year if you're watching this later, you can find those at Senior Savings Network, seniorsavingsnetwork.org, with a / of update. Or if it's in the middle of the season as you're watching this, there will be a link at the top of seniorsavingsnetwork.org where you can see the updates, which will include these deductible changes, increased costs, and everything else as soon as I get back to the house. Because it's Saturday, it's dead middle of the annual enrollment period. Our office is slam busy. We have a better crew this year. We've added some fantastic multitaskers, some amazing people who are keeping it all together, taking care of our clients. We have a new booking system for appointments where you don't have to call in and we call you back and we call you back and you call us back, and you can literally book an appointment for whatever you need done, whether it's a drug plan review for a current client only, Medicare Advantage plan you want to look at, or Medicare supplement. You can merely book that now on our page, which makes it a lot easier. God bless you wherever you are. Please feel free to share the news with a senior that you know and let them know that the administration has just raised your cost 14.8%, even in defiance of the Medicare Trust Fund folks. Medicare Trust Advisory Panel said we don't need to do that, and yet they did in anticipation of an Alzheimer's drug. Well, I hope the drug does work. They say it doesn't cure Alzheimer's by any means, but has been shown to have some impact on slowing it down. Let's hope that that's the case. Anyway, I'll get off this thing. God bless y'all. Thanks for watching.